everybody. This is going to be so informative. My guest is Danette Frauens, the Market Point Director for CarePlus Health Plans. And there's so much information, and Danette certainly is very smart about this. So I hope that you'll just sit back, relax, and listen. So hello, Danette. Let me ask you, tell us about CarePlus Health Plans.
I'd be happy to, Anita, and thank you for having me on your show. CarePlus Health Plans specializes in Medicare Advantage HMO plans, and we are actually considered one of the largest Medicare Advantage organizations in the state of Florida, and we have been providing Medicare benefits exclusively to Florida residents for over 20 years now. We have a variety of plans for our members to choose from, which were designed with their individual needs, and they all offer quality care, which our members certainly deserve. And just to give you a few examples, all of our plans come with routine dental, vision, hearing benefits. We offer them a monthly allowance where they can select from over-the-counter type of products and medications. We give them membership in our Silver Sneakers fitness program, and we also provide transportation to some of the plan approved locations, such as their doctor's offices.
That's excellent. So knowing that, when can someone enroll in a Medicare Advantage plan?
Well, you can enroll when you first become eligible for Medicare, and that's called your initial enrollment period. And it's a 7-month window. Now, once you're enrolled in a Medicare Advantage plan, you can change that plan once per year during the annual enrollment period. And that's been set by the Center for Medicare and Medicare Services. The time frame that they allot, it runs from October 15th through December 7th. And during that time, if you do make a change to your plan, the new plan will then start January 1st. Now, outside the annual enrollment period, we also have what we call a special enrollment period, but for that special enrollment period, you actually have to qualify or become eligible in order to change your plan. So some examples, more common examples, there's a long list, but some of the common examples are, let's say you lose or you drop your employer group coverage. Let's say that you move into a new area and your current plan isn't offered in that area. Or you might have a chronic condition such as diabetes. Or maybe you qualify for both Medicaid and Medicaid services. So those are ways that you can change your plan during the year if you qualify or eligible for any of those. I also want to point out that for plans that have received the highest possible rating from Medicare, 5-star rating, they're giving their members or beneficiaries an opportunity to make a change to their plan outside the annual enrollment period, and they can make a change up to 1 time per year. And I'm really happy to share with you that for 2022, CarePlus has been awarded a 5-star rating by the Center for Medicare and Medicaid Services, which is the highest rating that you can receive. So anyone who wants to join CarePlus, they can certainly join CarePlus any time of the year because we have that special enrollment 5-star rating.
So actually, I was going to ask you what's the meaning of a 5-star plan, but you just covered that, and that was very good.
Well, basically, a 5-star plan is every year Medicare evaluates all the different Medicare Advantage plans based on a ranking system that goes from 1 to 5 stars, 1 being a poor rating and 5 being excellent. 5 is the highest possible rating, and it really shows a Medicare beneficiary that the plan is offering quality service and support to its members. And Medicare rates the plans based on, their performance and across several different categories and quality measures. And they calculate it using all those different measures and then come up with the overall star rating. And then every year in early part of October, Medicare will release the star ratings for all the various plans right before the annual enrollment period, which is the time frame when they can make a change.
So Danette, why did CarePlus introduce this new CareSalute plan offering in 2022?
Yes, CareSalute is a new plan that we just introduced this year. It is a Medicare Advantage plan that does not include prescription drug coverage, and it was introduced or offered to our Medicare beneficiaries who are veterans. And really, we wanted to create a plan that offered them a way to complement their VA benefits, the benefits they currently receive through the VA. Now, that plan any Medicare beneficiary can enroll in CareSalute, but it was really designed with our Medicare veteran beneficiaries in mind, because we not only wanted to provide them with a plan that complements VA benefits, but also closes some of the gaps in their Medicare coverage. And supporting our nation's veterans is really a top priority for CarePlus, and we take it very seriously. And we're really committed to helping them not only achieve their best health, but have a great overall experience when they join a CarePlus plan.
So, okay, so you have talked about what these categories cover. So now the new rating, the plan star rating, how important is that?
It's extremely important because it allows a consumer to really, effectively evaluate all the different Medicare Advantage plans and see how they rank amongst each other, and allows them to make really a more informed decision about which plan they want to choose. Because it is an independent rating provided by Medicare, it can be a rating that can certainly be trusted. And CarePlus has actually received that rating for the past 4 consecutive years and 5 times overall, which really is quite exciting for us, because any time of the year, any Medicare beneficiary can join CarePlus because we are a 5-star rating, and they're not relegated just to the annual enrollment period, or in the event they qualify for a special enrollment period.
That's very important information that you're just giving us. So is CarePlus offering any new Medicare Advantage plans for seniors in South Florida?
Yeah, in addition to the CareSalute, which I said was designed with Medicare beneficiaries, veterans in mind, anyone can enroll in that plan, but it does not include prescription drug coverage. And that's because veterans receive benefits through the VA, which also provides them with prescription coverage. And some of the highlights of that plan is that not only does it offer them really rich dental benefits, such as crowns, root canals, dentures, it also gives them a $1,000 allowance towards the cost of hearing aids, and it's $500 per year, unlimited transportation to the provider offices, the Silver Sneakers membership that I spoke of earlier, and a monthly allowance for them to purchase additional products, many of which these benefits are not, or these extra services are not offered through the VA. So it really complements what they have and fills in some of those gaps. Another plan that we introduced for 2022 is called Care Breeze. Now, Care Breeze is a chronic condition Medicare Advantage plan for those individuals that suffer from a chronic lung disorder, such as COPD. So those are the 2 plans that we introduced this year. We're very excited about.
Right, and so I know you've just explained about the CareSalute. It's a great name. So why did CarePlus introduce the new CareSalute plans offering in 2022?
We really wanted to complement and support our veterans, complement what they're getting through the VA. It actually gives them a wider selection of providers to choose from. So just so your viewers know, if a veteran were to enroll in the CareSalute plan, they can still receive VA benefits through the VA, and the Medicare Advantage plan is not going to interrupt the VA coverage in any way. The only difference is that if they are seeking care through the VA benefits, then they're going to use the VA facilities. If they're seeking care through CareSalute, then they're going to use non-VA facilities that are part of the CarePlus network.
Right. I was going to ask you about what should eligible beneficiaries, including veterans, know about this, but I think you've covered it. So let me ask you, can Medicare Advantage and VA benefits work together? I think you were sharing that.
Yes, they can work together. Again, neither one interrupts the other. They can have both. They complement one another. Some of the benefits that CareSalute offers, such as the rich dental benefits, they don't necessarily get as rich benefits through the VA, but it all really depends upon their level of VA coverage. So again, we're just trying to close some of those gaps in their healthcare and really give them an overall, well-rounded Medicare Advantage plan, and the flexibility really to seek VA coverage when they want to. But if they want, let's say, a second opinion, or they want to use a particular specialist that is in the CarePlus network, they've got the option to do that.
Yeah, I just love the plans that you've been telling us about. This is great. So tell us more about CarePlus health plans and the plans the company offers.
Well, CarePlus is really dedicated to providing our members with plans that really improve their overall health and well-being. We want our plan members to be happy, active, and independent members, and we really take that seriously. We want to provide them with the best possible experience because we want them to stay on our plan for the long term. So there's different criteria that a Medicare beneficiary should take a look at when choosing a Medicare Advantage plan, such as CareSalute or any of a variety of our other plans, because at the end of the day, they have their individual needs, and that's what they really should be focusing on. So for example, let's say we have a member that takes several different types of prescription medications. Well, we want to make sure that the plan that they're selecting's formulary covers those prescription medications so they can keep their costs down. Let's say there's a particular doctor or specialty they want to continue to see, and they certainly should check with the plan to make sure that provider participates with the plan. If they have a chronic condition such as cardiovascular disease or diabetes, we have chronic plans that are designed specifically for that. And also if they qualify for both Medicaid and Medicare, CarePlus can help them with regard to that. So really they want to look at their individual personal needs, see what the plan offers, see what the costs are that are associated with the plan, what are the extra benefits and services the plan is offering in comparison to others, and finally, and really important, they should definitely consider the star rating of the plan because that really tells them what the members who are currently on that plan are experiencing in terms of quality health care and services.
Well, let me just tell everybody, you've been listening to Danette Frauens, the Market Point Director for CarePlus Health Plans. We're getting so much information from you, Danette. I appreciate it. So now, how can I connect with a license? That's what someone's going to be saying. When they watch you, they're going to say, how can I connect with a licensed agent to learn about my Medicare options?
Absolutely. So if anyone out there, any of your viewers would like to learn more about CarePlus, they can certainly call one of our licensed sales agents at 1-855-450-1352. And that agent will take quality time in asking them a series of questions, getting to understand and know what the concerns are of that member when it comes to choosing a plan, reviewing all the various plans so that they can help them, make the decision that's best suited for them. And that's something they can do over the phone. So if they decide to enroll, they can also handle the enrollment over the phone. But for our viewers that would really like to meet, face-to-face or in person with one of our local sales agents, they can contact that same number at 1-855-450-1352 and ask for the agent to schedule an in-home appointment with a sales agent in the community or at any location of their choosing. And they're going to spend the same amount of quality time. Our agents are very well trained, and there's no obligation whatsoever.
Well, okay. So if someone wants more information, you want to go out of, do you want to talk about the website a minute?
Sure. If they wanted just to go through our website, and because it really has a ton of information, it has all of our different plans, all of our different services and our different programs that we offer and where we are located in the state of Florida. They can certainly visit us at www.careplushealthplans.com, and that's all one word.
Well, Danette, it's been wonderful talking with you. Thank you, Danette Frauens, the Market Point Director for CarePlus Health Plans, and just stay well.
Thank you so much, Anita. I really appreciate it. And if I may, on behalf of CarePlus, I want to thank all the veterans out there, past and current, who have served our country. Really thank you for your service.
Good. Yes. Thank you very much.